Hi folks, welcome back. First and foremost, I'm trying to work on some technology, make this a little bit better, or run smoother with answering your questions and using the video. My brother-in-law either told me I was old-fashioned or old, I can't remember what he told me, but said I needed to get a little bit more up-to-date with technology, so Frank, I'm working on that. I'll answer like one question, bring you up to date on coronavirus, and then you folks will be on your way. I want to update you too. We're all in this together. We're all equally affected. We're a small business. We're trying to survive as well. But at the same time, we're trying to protect you all and prevent you from coming in if you don't need to come in. So if we can talk to you over the phone, take care of things, that's what we're trying to do to keep you away from here. Like I said, we're in this together, and we're a small business, so we have to survive too. We have to contract our hours down. We have some layoffs temporarily of some of our favorite peeps here, but we got to do what we got to do to survive, and I think that's pretty much all of us right now. So let's start with an update here. This is where we are down here, we're the United States. This is Korea, South Korea. So they're ahead of us in this whole outbreak. Our goal here is to be like South Korea. If you look up here at South Korea, they started with their outbreaks. Here's the number of outbreaks. So they had 0, and they started about mid to late February. Here's February 19th. They started to spike here by the beginning of March, and they essentially are almost back to 0 new cases by mid-March. So that's about a month-ish for South Korea. So they had this peak, and they've already started to almost get back to baseline. So it took them about a month. So we're here. We're just getting started. So early March, we are right here, March 6th. So this rise right here is this right here. We're just starting to go up here. Ideally, we'll follow South Korea. So we'll go up, hopefully take about a month-ish, which will take us to mid-April, and hopefully come back down, or at least be heading down by mid-April, and hopefully back to baseline by May. That's the goal. There's nothing to do except stay away from people and wash your hands. And the truth of the matter is there isn't anyone in the whole world that's more powerful against this than any of us. We all have the same power, and that's to stay away from it. Stay away from people, keep ourselves clean. That's all we can do. The best treatment is actually to not get it. Also remember, the goal is to prevent death from this, as well as sickness. Because if a lot of us get sick at once in this country, there are not enough beds, there are not enough ICU beds, there's not enough medical personnel, and there are not enough ventilators to help us get better. So we don't want us all getting sick at once. We can get sick gradually and keep the curve flattened. So some people get sick over a longer period, but we don't want everyone getting sick at once. That's why we have all these measures in place. Okay, so I'll move on with the question. And the question is, Mike, what is a stork bite? So this is what you're referring to. This is a salmon-colored patch of skin on the back of the head of this baby, which can occur in up to 50% of babies. It's called a stork bite when it's on the back of the neck. If you see this discoloration on the front of the face, it's generally called an angel's kiss, because that's where an angel kissed the baby. These generally resolve on their own. There's nothing to do for them, but some never go away, and you don't see it on people because their hair grows and the hairline covers them up. But you will see these if you're at the grocery, you see an older gentleman, he doesn't have a lot of hair, or his head shaved in the back. On some men, you'll still see this because they never go away. They're just a collection of blood vessels. They're called a hemangioma. They're just under the skin surface. If they're below the fat layer, they're more bluish, but just under the skin surface, they're red. I'll show you another example of a hemangioma. This is more bulbous. Sorry. So this kind of sticks out, protrudes. This is around the eye. This is a little different than the other one. The other one's more flat. This generally resolves on its own too, with nothing, no intervention. Generally within a year, sometimes as late as 5 years. When they're around the eye and they can affect vision or blood flow, sometimes you have to do something about it sooner than later. The treatment right now is an oral medicine that's used for heart disease. It was used for heart disease primarily in adults, and they found that if children received it, it caused this hemangioma to involute on its own and go away. So the first line against this is, if you need to treat it, is an oral medicine. There's some laser therapy that helps stop the growth of this, and then surgery would really be the last resort, because you don't ever want to cut into the face of a baby and leave a scar, because the skin isn't done maturing, and as the baby grows and the skin grows, the scar would grow and it would need to be revised later. So there's no reason to do anything cosmetically for these kids unless it's going to affect them in their lives. So the next question is, why is it called a stork bite? So this guy right here, Hans Christian Andersen, he lived in the 1800s, and he's a very famous author, and he wrote a book called The Storks. He wrote all these other books too here. Snow Queen, Ugly Duckling, Little Mermaid. And of course, if you want to depress your kids, this is a spoiler alert, read them The Little Match Girl, because at the end, she freezes to death. And then, of course, everyone's favorite, El Vestido de l'Emperador. Anyway, so these are all his books. Now, this Stork's book that he wrote was about storks that would deliver new babies and brothers to good children, and the storks would go to the baby pond for the new babies, pick them up from the baby pond, and take them to the good boys and girls, so the good boys and girls had a new baby, sister and brother. But if they were naughty, they would not bring them a new brother or sister, hence the quote, "One for each of the children who have not sung the naughty song." And you can see they carry them around the neck. So the beak is around the neck, and the beak hits the front of the neck and the back of the neck. That's essentially it. That's why it's called a stork bite. Explained to you what a stork bite was, how they generally go away, different types of them. And I think that answers the question. So keep the questions coming. I've got time here. Spend a lot of time, or I can spend more time answering them. Please remember what the goal is here. It's to stay away from people. It's to keep your hands clean and to wait. You got a good 3-4 weeks of this at least. So thanks very much. Stay healthy. Bye-bye.